Dr. Jian Jones.
Can you hear me?
I can hear you. You're a little quiet, but I'm exceptionally loud, so maybe it's just me.
Okay. What's good? What's good? What's good?
My daughter says, yeah, it's just you. Yeah.
Hey, baby girl faces.
She said, hey, baby girl faces. She said hi back. How you doing, my friend?
You know, everything is everything, like Lauryn Hill said. So we sticking and moving, they say down in Miami.
I like it. That's why I like it. And listen, I tell you that every day, like nowadays, like good is great. If I'm good, I'm great. I'll take good. So it's good to see you, my friend. I haven't seen you in quite some time, but it's good to see you.
It's good to see you too. I am absolutely honored to be on Hip Hop Can Save America. Absolutely honored. So thank you so much for asking me to be a guest.
Of course, long overdue. The honor is mine. But I had to make it, we got to get the cameras right. We got to get lights. We got to, good looking folk. We got to present ourselves in the right way. So we had to do it right. So it took a little time. Yeah. So listen, please introduce yourself. I gave a little bit of a prelude, I guess, to our talk. Obviously, it's on the screen. Occupational science. I remember I said to the folks before we came on, I said I didn't really understand this before I met you. Like I didn't get it, and then you kind of broke it down to me, and I'm like, oh, this is fascinating. So I want you to get into it for the lay folk out here who might be listening. And then obviously the connection to hip hop, why we're even talking, why you are, and again, the honor is mine to have you on the show. But present yourself to the world as you would like to be presented. I don't just want to read your bio. Just tell the people who you are as you like to be presented,
That's dope. Hey world, hey young world, the world is yours. My name is Dr. Jian Jones. I am from Tallahassee, Florida, by way of a very small town in South Georgia titled Pelham, Georgia. I am an occupational therapist by trade, but I'm also an assistant professor at Florida A&M University, which is FAMU, a HBCU, the number one public HBCU in the nation. I served as an acute care occupational therapist within a hospital setting for about 9 years before transitioning into academia to teach the future occupational therapists of the nation and world. And in doing that, I realized that there are aspects of our identity. And when I say our identity, being at the HBCU, where you have multiple cultures within graduate programs and undergraduate programs, I realized that I was teaching from a traditional gaze. And if I am teaching the students about how to use therapeutic use of self and how to relate to clients, which are individuals on that very meaningful personal level, then why should we have to, I would say, dissect or compartmentalize an aspect of ourselves that is not necessarily accepted, which would be hip hop culture or hip hop identity. And so even though I'm an occupational therapist, I'm an educator and researcher as well, I started to investigate and explore the benefits of hip hop culture within the field of occupational science and occupational therapy. So occupational therapy is a rehabilitative profession. It is the cousin to physical therapy. We help individuals learn or relearn how to participate in occupation, meaningful activities that bring you life satisfaction. And so just with that exploration, I fell in love with the fact that I was able to intersect that, even though there was no pathway for it within the occupational science and occupational therapy discipline. So I pulled from, those that we know, Christopher Emdin, Bettina Love, Gloria Lassett-Billings, I can go on and on and on. And I just put that or situated that within the occupational science and occupational therapy space. And here we are today. I have presented data and research as it relates to intersecting hip hop and occupational therapy education for student empowerment, for student self-determination, for self-reflection on fieldwork, to improve achievement and performance. I have done a few things. So that's a little bit about me. I'm a mom of 3. I love to work out and eat healthy. I love documentaries. So that's a little bit about me.
I was just saying how important documentaries are. That's fantastic. Y'all see, when I told people before you came on, like we get the smartest people, we get the most interesting people on this show. It's really just a blessing. It's amazing. That is all fascinating and a mouthful to us, regular folk. But it's super. This is so fascinating to me, and I've been on your show, so shouts to the 215s podcast that you That's right. So, you're in a podcast game as well. And it was the honor was pre-reciprocated for me to be a guest on there. And you were asking me some questions about occupation and the idea that, and you just said it, you said sort of the idea that the things you do in life to live a successful or a happy or a fruitful or prosperous life, that's occupation. Now, as you know, a layperson is going to say, wait, occupation means job, right? Occupation means, right. So one step back, just you said it, but I want you to expand upon it. The idea, and again, the difference between occupational therapy and occupational science. I understand that occupational therapy was first, and there was some confusion at some point about exactly what it is or what it's supposed to be. Yeah. And then occupational science was developed to kind of try to, I guess, codify what occupational therapy is actually supposed to be. And then now folks like you are taking it to the next level. Explain all that in a way that makes sense.
That's dope. You are an amazing journalist. So, right. Occupations are things that we do each day. So like you said, things that we participate in that bring us meaning and life satisfaction. That includes self-care. Self-care is grooming task, is toileting task, is eating and drinking, right? It's driving yourself, which is community mobility, being able to get from point A to point B. But it also includes what we participate in terms of work, how we provide a skill in order to receive money to take care of ourselves for that self-preservation and to but provide for our family. So occupations are those meaningful tasks that occupy our time with meaning. So occupational therapy is the rehabilitative aspect where if there's a deficit or injury or diagnosis and there's a discontinuation of participation in those tasks, then we help you with strength. We help you with the cognitive processes to be able to motor plan how to complete those things and etc. Now, the science piece, occupational science, is the study of occupations, how we participate in different occupations, the different cultures that have occupations that are different and various, or those that we share with another culture. And so the science aspect just gives us more foundation and grounding in what we do as people worldwide and how we can use that to further feed into the therapy aspect to push the profession forward.
What's an example, a real world example of someone who's receiving occupational therapy?
Someone post-stroke, CPA, where they have lost strength and endurance on one side, so hemiparesis or total paralysis. Yeah. And so we will have the individual, after completing an evaluation, participate in strengthening task, relearning task, right, or either adapting or compensating and using the opposite side in order for them to be able to be independent or as independent as possible. Right. Go ahead, man.
No, it's sort of in conjunction with physical therapy, right? Physical therapy is actually getting your body right. Occupational therapy is sort of like getting your life right.
Yes. So what I like to tell specifically students when they're trying to figure out if they want to do PT versus OT, physical therapy is in short term. So all my PT friends, don't come after me, y'all. PT is going to get you strong enough to do something. And we are going to help you actually complete those steps to do something. So another example that I give to potential students is physical therapy. Physical therapy will help you walk to the bathroom. Occupational therapy will help you use.
Okay. All right. Well, both are important, I guess.
Both are very important. But something to relate, I would say to the younger generation, not that those in the younger generation will not or cannot suffer from a stroke or a cardiovascular accident or an ischemic attack or something like that. Right. I would say, God forbid, in a motor vehicle accident, and there is a fracture to, let's say, the lower extremity, the leg, or either the upper extremity. So the humerus is this bone here that connects to our shoulder, and then our elbow is an aspect of the humerus as well. So if there's a fracture there in the humerus and over time there's still weakness and maybe some numbness and tingling because there was also injury to maybe the median nerve with that humerus fracture, then what we could do is, let's say the individual who was in the motor vehicle accident was a DJ, right? What we would do is we would have them participate in motor coordination. We would also work on some things to desensitize that tingling feeling so that they can actually feel the vinyl if they are old school, if they are if they're more analog, if they're more digital and they're using the more electronic turntables, then we will just actually have them do that motion and movement so that we are regenerating the nerve a bit so that they can participate in that either hobby, which is meaningful for them, or in that job that they are able to be compensated for.
Right. Definitely. Like, it doesn't have to be their job. That could be their catharsis, their catharsis, their therapy. I made beats when I was feeling low, and I would make beats, and that was important to me. And if I wasn't able to do that, I would want someone to help me get back to that, even though that wasn't the way I made my living. It was the way I made my peace.
But I would also say with that peace part, if you weren't able to DJ because it brings you some type of peace, some type of joy, how would you feel over time if you're not able to participate in that task?
Right. Right.
So that's where the OT comes in. We help with that shift in identity, because then there's an interruption in the identity. I cannot participate as a DJ.
I'm not who I was.
Absolutely. And so then that's where that rehabilitation has to come in.
Wow.
But also allowing an individual to accept where they are so that healing can occur.
Right. Sometimes you can't be who you were, but there's a way to work with that.
Absolutely. Yeah, and
I'm stumbling over the words, but you know what I'm trying to say.
I do, because that's also an aspect of occupational therapy. We look at the holistic individual as a whole. So the mental, the emotional, the spiritual aspect, we do bring in the spiritual aspect according to the individual. So we can't offer anything.
Right.
This is my spirituality and it's tied to my identity in this way. And so I would like to do this. Then that becomes an aspect of our intervention or their intervention plan, because they actually stated that they would like for it to be.
Right. Yep. It all works together. And I guess that's a missing piece that without that, people would have a much tougher time getting back from some of these things. So this was something you did. So you were doing this in practice for a while. Is this right? So how did you say, what was it sort of the transition in your life to say, I'm doing this, but I also want to, I guess, start teaching it, or to start, moving in that direction?
Well, the opportunity was presented to me. I absolutely did not want to teach, Manny. I have so
many people come on this show and be like, I wasn't even thinking about teaching, bro. But it just,
no,
I know. Right.
I had a professor tell me when I was in the graduate program for my master's in occupational therapy that I was going to teach. And I said, no, I'm going to retire as an occupational therapist in the field as a clinician.
Right.
And Lord and behold, I think 2.5 years later, one of my old professors, a different professor, called me and asked me if I was interested in adjuncting for a pediatric lab.
Okay.
And I was like, yeah, sure. What do I have to do? And she was like, exactly what you saw me do. And so I adjuncted for 3 semesters, and a position became open, and they asked for me to apply. And I applied, and I became the academic fieldwork coordinator as well as an assistant professor full-time. So I transitioned from the hospital into academia.
Right.
100%.
Yeah, this was where? Was that Florida, or?
It was at, Florida A&M University. So at TMH, Tallahassee Memorial Hospital, and I started working for Florida A&M. Routes.
What was the, for those folks who might be listening, who might say, listen, I do a thing, and now I might want to transition to being a teacher of that thing. What was that briefly? I'm sure it was a, wild time. What are the takeaways from that transition?
I would say be prepared for the next steps, even without thinking about it. How do you do that? By performing the best that you can at each level, because that opportunity came to me because I was a good student. Per them, I was just trying my best to get into a career where I could provide for my son, and help my husband at the time. And they told me that I was a very bright student, and they saw at that time, some of the characteristics of a good professor. So I would say wherever you are, just do the best that you can. It's one of the 4 agreements. Always do your best. And so that's something that I would offer for those who may be thinking about transitioning. Even if you don't like where you are, still do your best, the best that you can, so that those that may be in a position to offer you something better, they can. I would also say continue to be a life learner. I kept all of my books. I stayed abreast of the newest evidence, because in healthcare, we strive to be of evidence-based practice, or to implement evidence-based practice, as well as client-centered care. And then being humble. Humility is big, because when individuals can identify humility within you, or another individual, I feel like opportunity comes your way due to that. So be confident, and have some pride about yourself, but also be humble enough to know that there's always more to learn in any situation and in any field. And I feel like that's enough to get spotlight, so that you can receive some of those opportunities they have.
I'm glad they recognize it in you. Sometimes they don't recognize it in the right field, but sometimes they do. Sometimes it works out.
Yeah.
Very good. So, what's the connection? You said somewhere that the future of occupational therapy is hip hop.
Absolutely.
Is that right? That's the right quote?
Well, the future of occupation is hip hop.
Okay, the future of occupation is hip hop. And that ties very closely into the field, obviously. So what is this magical combination, this intersect? Because I love the intersections. You know me. That's all I talk about. The intersection. I said, you want to be a better plumber? Hip hop can make you be a better plumber. Let's talk about it. So how does hip hop factor into the work you are doing?
Because hip hop is in everything. So if occupation are activities that we participate in order to live a meaningful life, or to reach life satisfaction, if hip hop isn't everything, hip hop brings us joy. And I'm not just speaking for me, I'm speaking for you and conversations that we've had, and other individuals, my students, and other researchers that have to embed hip hop culture and bring the positives to the light and in media about hip hop culture, versus just what industry tends to push. Hip hop is in all of that. And so when I say the future of occupation is hip hop, I'm just saying that there's going to be more individuals like myself within the field of occupational science and occupational therapy who aren't afraid to present their hip hop selves.
Right.
I am stating that we are going to bring interventions that are centered or situated in hip hop. So if I am working with a kiddo that has sensory issues, sensory means that I have issues with maybe different textures. That's just an example.
Okay.
Why not do a foam graffiti wall? Just take some shaving cream, pour a little food coloring in it if there aren't any allergies to food coloring, right?
Sure.
Put it up on a board and have them play in that as if they are tagging a wall. A word search cipher for those that have issues with visually scanning from left to right or right to left, because that is going to interrupt how we participate in activities. A cipher is dope for that. Being able to dress yourself. So just giving them that fly girl, B-boy style to throw on and button up to work on their fine motor strength and dexterity in order to be independent in dressing. We are coming. And when I say we, those within hip hop culture who identify with it and who state that we are hip hop identities are the future of this profession. So that's what I mean by the future of occupation is hip hop. There's going to be more occupational science research that includes hip hop, the different elements of hip hop, the different ways that hip hop has inspired individuals to participate in different tasks, as well as the therapy aspect from the examples that I gave previously. So that's what I mean with that very provocative stance that the future of occupation is hip hop, because it is.
You want a show called Hip Hop Can Save America. We're all about provocative statements over here. I wrote 2 things down. One is I want to go back the second thing second. So I want to find out sort of what that research looks like. What, as you say, there's more people coming in. You're a researcher as well. But we'll come to that in a second. Just the thought that popped into my head was obviously one of the, we talked so many times. You mentioned Dr. Bettina Love. One of the great lessons I learned from her was the idea that hip hop gives, especially young people who don't always have agency, right? Don't always have the feeling of being seen and heard, a way to be seen and heard. That's what hip hop was. It was, all of the elements, the graffiti, the tagging on the trains was, they think I'm nobody, right? This city's left us for dead, but I'm going to design this art piece with my name in a way that nobody else does, and you're going to know it's me. So I'm establishing myself as someone. I am someone, and this is my representation of who I am. And the DJ, the MC, all the other folks, the breakers, all did that same kind of, I'm establishing myself. And what Bettina Love always, stresses is that we know how to do that inherently in hip hop, right? And again, also in other cultures, in Black culture, in immigrant culture, like just kind of like the get in where you fit in, make $1 out of 15 cents, that hustle mentality. But we don't always know that that's what we're doing. They don't always know that that's what they're doing, that they're doing social and emotional intelligence, that they're doing, all these things that now are buzzwords in education or in medical settings, that it's just something inherent in folks who look at the world through a sort of a hip hop, creative, anti-establishment, whatever lens. And what you're saying here is like, you're showing folks who have this need to kind of get back to a place of comfort in their life through some sort of trauma. You're saying we're going to use the same techniques, right? The same kind of things that all these young people found a way to like be someone and come back to the world, to be a part of the world that they had been pushed away from. Is that the parallel I'm seeing here? Mm-hmm. I hope I'm establishing this right, but
yeah, for me, yes, because particularly within the field of occupational science and occupational therapy, it's predominantly white female. And so when you have an individual like myself going to conferences, or if I am applying for a job and there's a panel for the interview, and I am the only person of color on that panel, then it feels a bit isolated.
Of course, yeah.
And that's actually one of the occupational injustices, is isolation, or part of one of the injustices is isolation. And so how do I create belonging for myself? I tag something. How do I tag something? I put it in my presentation. I say that I'm the dope slanging OT, or I will present a poem before my presentation that states that I'm a dope slanger. But dope is a metaphor for fresh, for innovative, for different, for great, versus what will come to your mind, as in the white female population, particularly in my experience. When I say dope, it makes it negative. So let me make it positive. I know a student who was an undergrad at FAMU, but now she's a student at a very prominent PWI. And she wrote a paper on hip hop as a space or an aspect for belonging, because now she feels ostracized. She feels pushed to the margins because she was at an institution where her culture was embedded within, but now she's at an institution where she doesn't feel like she fits in, and she's homesick, and she wants to bring herself back to the state of Florida. However, by writing that paper, including hip hop culture as a space for belonging, is her saying, hey, I need you to see me, because she has to turn that paper in.
Right.
Her instructor or professor has to read that paper, and that's going to help them see her better. So she's using hip hop as a way to be seen, just like you said about the graffiti artists. Right. So yes, it is the same parallel. It's the future of occupation is hip hop, because you all have refused, even if it's not on purpose, you have refused to shed a light on me. So I am going to make sure that I turn on this light switch for myself, using one of the dopest things in the world, and that is hip hop.
Right. Indeed. All right. I like it. Makes sense to me. It makes sense to me. It seems like it just makes sense, but I don't know. They don't seem to think it makes sense sometimes, but it makes sense to us.
Right. Because we because it's a part of our identity and we get it. But what I love about what you do and what you continue to do is just push the positivity in hip hop because that's so important. And I feel like majority of media, majority of communications is just pushing that very narrow perspective of hip hop. I heard you earlier talking about the P rap, and it's very gangsterized and misogynistic, and just the different aspects of hip hop culture that influence in a negative way. And that's what they see because we feed on drama. So
Right.
it's the negative aspect versus how hip hop has saved lives, how hip hop can save America, how hip hop is allowing a student who now feels pushed to the margins to belong in a place, you know? And so those things need to be brought to the forefront. And that is what you are doing. And I appreciate that.
I appreciate that appreciation. It's only because there's people like you doing the work. I've said this before. If I wouldn't have anything to talk about, I would just be like, yeah, trust me. No, you don't have to trust me. We have the receipts. So with that said, what are some of the ideas or what does the industry as a whole, right, need to, you touched on it a little bit, you know, again, presenting that paper, lets the instructor, lets that institution see, oh, we might be missing something here. Mm-hmm. You know, we've heard so many things in the health spectrum, you know, of, you know, whether it's racial biases affecting diagnoses, right? Or, you know, all kind of things that have cropped up. I just saw this thing today where some tens of thousands of women, maybe not women, but tens of thousands of Black folk couldn't get a kidney transplant. You see this news? This was just breaking. Didn't get a kidney transplant because there was a racially biased organ checklist test that happened. And so now they're bumping up tens of thousands of people who were previously pushed down on the kidney transplant wait list. Now, this is personally just an aside. I actually donated a kidney.
Oh, wow.
I don't know if you know this, but, you know, fun fact to anyone watching, I'm a living kidney donor. I donated to my daughter almost 5 years ago this April. This actually is the tattoo that signifies this, April 25th, 2019, to my daughter who's Black, right? Because she's mixed. Because, you know, she's on the waiting list. But this is a very personal situation where tens of thousands of people, because of a racially biased test or some kind of checklist, I didn't get the whole story, so I'm paraphrasing. So we see this across the board, and they say, oh, you know, oh, why you bring up the race card? Because someone didn't get a kidney last year. Now, today, because of something where there's racial bias in the healthcare field, as you just mentioned, in the occupational therapy field, this is not immune to it. So hip hop is being an equalizer of some sort. You know, we've seen it in the education space. Hip hop is saying, listen, you know, it can help everybody, right? Everyone, first of all, everyone loves hip hop. The techniques that they use in hip hop education can help white kids in Idaho in the middle of, you know, rural somewhere, but it can most benefit those who have been traditionally underserved, under-resourced, and underloved by, you know, generally a sort of, you know, white supremacist society. What does your industry need to do to ensure that folks like yourself are helping as many people as possible in the most efficient way? What are the hindrances? What are the roadblocks? What are you doing? What's the research? What's the prospectus for your industry moving forward? Big question.
Listen to Black, Indigenous people of color. Don't just always feel that somebody's pulling the race card, because that's not necessarily true. There's a good amount of research that is speaking to biases within the practice of medicine as well as practice of healthcare, because like occupational therapy, physical therapy, nursing, etc., may be a part of allied health at times. Nursing is typically or in most instances, it stands alone. But then you have medicine, the field of medicine, and that would be your physicians. So either your MDs, your DOs, PAs, nurse practitioners, etc. And so listen and pay attention to the fact that a lot of the medical science that was produced, the seminal work, was very racially biased. And we are still, to this day, taking the time to conduct other or new contemporary research in order to deconstruct some of those things that were established before. And so with those things being established before, things as in thoughts, theories, stigmas, that takes a while to break down. And so you have to listen to the individual, regardless of what the research may say. I'm not saying to completely ignore the research. You take that information and you also pay attention and be very mindful to what the individual is stating in front of you. Help them from there. If this individual presents something that you've never seen before, I would say take the next step to research more about maybe their blood type or where they may come from. Ask them if they know anything about their primitive tribe. And when I say primitive, as far back as they can tell you, because that may give you a little bit more information on how to intervene with the issues that have arose that are causing the deficits and the discontinuation in performance and improvement. And so I would say to just listen to the person that's in front of you. Also, try to look at things from the individual's perspective. Do your research. Watch documentaries. If you were talking about documentaries earlier about individuals who are within hip hop culture, whether Black, brown, Asian, what have you, just pay attention to these things so that you can learn more about it. Watch the Freaknik, just an example, watch the Freaknik documentary.
Right.
An understanding of why a group of poor college students who couldn't travel started something and how that blew up into a cultural phenomenon. And yes, it was shut down, but just pay attention to how powerful those individuals were because they had very little. It's just paying attention to the people that are in front of us versus just solely relying on the research and the book information, because typically research and books are written from the dominant gaze.
Yeah.
Dominant being traditional Eurocentric view. And so with that being said, we have to, things are getting better, but it doesn't mean that there isn't more work that needs to be done. There's a lot of work that needs to be done for us to continue to break down these walls. So in closing the loop on my response is basically listen to folks instead of just relying on the research, because a lot of times it doesn't involve a good number or good sample of people of color.
Yeah.
Black folks. So what we're using to intervene on their behalf, they weren't involved in it. And so it's not best fit, or it may not be best fit. But also being mindful about another perspective and try to consider that perspective, because at times we can't see things from another person's perspective, but we can consider it. And so those are my recommendations.
Yeah. Do you think that would be one of the tenets of being in healthcare to begin with, right?
Yeah, but we get,
I know,
in,
we get
not
caught up.
necessarily college, we get.
Healthcare is a tough field. The healthcare it's a tough field, and there's a lot of, there's often a lot of politics, overworking, and people just don't get the time to kind of expand their mind. They're just doing the job and getting it done, and
Yeah, just a quick example is we have ADLs and IDLs. ADLs are activities of daily living. IDLs are instrumental activities of daily living.
Okay.
ADLs are more basic. So like I mentioned earlier, that would be your grooming tasks: brushing your hair, brushing your teeth, washing your face, eating. But cooking a meal requires more tasks. So that's going to be an IADL. Driving a car is going to be a more complex task. It has more steps, takes more cognitive processing. And so that's going to be an IADL. Sex is an ADL. It's basic, right? There was a student.
I'd actually be very complicated with my sex. So it's probably okay.
And that's fine, but it's still on the humanistic level. It's
all right. Fine.
A basic need, right?
Whatever. Fine. Just.
And so there was a student who was interested in sex therapy as an occupational therapist, and I remember the director. There's a director that shut her down, and this was maybe about 8 years ago. This director shut her down and told her that that was inappropriate. It was too niche. Manny, I tell you today, there are multiple sex OTs.
Okay.
Multiple. On Instagram, you have pelvic floor occupational therapists. You have pelvic floor physical therapists as well. And those are individuals that go in and make sure that the musculature is working properly for using the bathroom, but also to engage in sex. And so I just feel like we have to be more open-minded with progressing. And I feel like if it would have came from a student that was not necessarily a Black student or a student of color,
right,
that it would have been received better, right?
Gotcha.
But it wasn't.
Yeah.
That my theory is that it's because it came from someone that looked like her. So we just have to be more open and not shut down individuals that have these innovative, right ideas because of what has already been established.
I hear you 100%. I think all the innovation comes from these communities and these folks and brilliant folks. There's brilliance abounds, and it's you do your cause a great disservice to ignore it or to pay little attention to it. Real quick, Ada Johnson, Miss Thursday, her moniker is very much in the healthcare field. So she's been tuned in and turned up in the whole comment section. You'll see it afterwards. I guess she's been very engaged, and she's a good friend of the show. She said she worked in a rehab facility and used hip hop to help her patients when possible. I work with my OT to help a patient use graffiti with fine motor skills. So again, yeah,
that is so dope. And see, that's what I mean. Like, there are individuals out here that are doing this, but there's no one writing on it because researchers and scholars that will say, or academics that will say that it's not rigorous.
Right.
Yeah. I don't understand. What do you mean? You're taking an aspect of culture that has been under researched. There's not enough literature about it within our field. That, I mean, we need to fill in the gaps. That's what we do as researchers. That's what we do as scholars.
So go ahead, finish your thought. No, finish your thought. Yeah, it's amen to Ada.
Yeah, that's dope.
Yeah. So now as we start to close out, I won't keep you all night. I know it's getting late in Florida, it's the same as me. It's not late. Let me try it. But you might have, I don't know, are you like teaching this week? Are you on break? What's going on?
No, I'm teaching. I have class tomorrow.
Oh, okay. Well, we on break out here in Georgia. My daughter's off. I figure everyone's off.
Spring break. We had spring break 2 weeks ago.
Well, so yeah, because in Florida, everything's advanced. Everything's hotter, earlier, and I don't mean advanced in a good way. I just mean quicker.
Yeah, probably. Yeah.
Yeah, like it's hotter, quicker.
Mm-hmm.
Yeah, I'm still getting used to Georgia. I'm from New York, so I don't understand any of this weather, these patterns. These bugs. I'm still getting used to it all. So not to keep you up all night, but so what are the kind of things that you personally, we talked about the industry as a whole, trying to listen to people, obviously that cultural, it's the same thing as education, right? The culturally responsive, culturally affirming pedagogy that, we talk about with hip hop all the time in the education space. Same thing. Just, know who you know your folk, know who you're dealing with, understand that connecting culturally is going to just give you a better camaraderie. First off, we talk about doctors. Well, I have a good friend who's a doctor, emergency trauma surgeon, actually, one of my best friends, brother from another mother. And I talk to him all the time, about hip hop and all these intersections. And he's like, And I'm like, let me tell you something. You deal with people. You're customer service. In the healthcare, like you talk to people. You have to deal with the public. And if you could just connect a little bit better to somebody and their culture and their, how they see the world, they might open up to you a little bit better. You're going to get a better response from them. They're going to be a little bit more truthful with you. They're going to be a little bit more, open with you. This is what mental health therapists do when they say, I bring hip hop into the mix. Like we talk to folks all the time. So it all makes sense.
It does. Yeah. Quick story. Young man came in with a gunshot wound. He was at a club. Smelling like flowers when he came in. I mean, I swear he was one of my cousins. And so I went in talking with my, with my home vernacular, my home tone. What up? How you doing, bro? What's going on? What happened? He like, I can't tell you what happened. What you need? And I said, well, the physician asked me to come in here and see you. I'm an occupational therapist. I explained what it was. But the way that I talked to him, that I spoke to him was at his level because it's like, I see you.
Right.
Because I did.
Right.
There was no judgment. I was actually a lot more comfortable in his room than I had been in any other room because I speak that way.
Mm-hmm.
That's before I transitioned into academia.
Right.
And when I tell you that he gave everybody HU double hockey sticks, except for me and my homegirl. She's a physical therapist. We incorporate hip hop identity. He was waiting for us to come. The nurses would call, "Hey, can you come and work with so and so?" We like, "Why? We just saw him." "Well, he won't listen to us." "That's because y'all not. You have to see him. You're not seeing him for who he is. You're judging him because he smells like flowers." And I mean, he had locks, so it's in his hair.
Sure. I get it.
And because of what the words that he's using, but he's still a human being.
100%.
Treat him like a human being, y'all gonna be good. Yeah. So it's you got to meet people where they are, which is that reality in the education field, reality pedagogy that Christopher Emdin
That's right.
About a while ago. So anyway, meet where they are, and that was one of my favorite stories, which showed me that I could use that aspect of me to be therapeutic. And in occupational therapy, we call it therapeutic use of self. You use aspects of who you are to establish rapport, to assist with morale with the individual that you're working with. So if we all did that, come on.
So it's therapeutic use of self. See, that's what I'm saying. Like, we do these things inherently. We didn't know how to tell you what we do.
Right.
But these are the words that make sense out of it. Yeah.
Yeah. And I actually, in presenting and in my papers, I'm writing that that's related to the fifth element that KRS stated.
Sure.
Knowledge of self.
Knowledge of self.
You know who you are. You know how to use aspects of who you are to relate to somebody else. That's all that is.
That's right. Real recognize real.
Absolutely.
You know what it is. That's what's up. So these are the things you're looking into as a researcher. I guess I would imagine, when you say you present, you talk, we'll close it out on this. What are kind of all of this, right, is what you want to kind of look at, and how do you look at it from a researcher lens? Like, what do if I'm, the great Dr. Jian Jones, how do I have to look at this? How do I have to put this together? What are the presentations I'm doing to try to make this, more understandable, more prevalent in the field?
So operationalizing how I use hip hop culture within the field, ways. And so from I would say academic fieldwork coordinator, that's the individual that places students, the OT students within their fieldworks. I am utilizing hip hop themes for self-determination, like I mentioned earlier, or for self-reflection. While on fieldwork, which is their internship, they have to do a weekly reflection, just explaining how the week went. They have to establish goals, and they also have to report back on the goals that they established the week prior. Well, in two separate fieldwork rotations, one I used Loaded Bases, which is from our late great Nipsey Hussle, and they had to use an acronym titled LOAD to help them plan for goals, and that was attached to self-determination. But I also use Outcast themed journal prompts, Speaker Box versus the Love Below. So Speaker Box is you're amplifying great things about the week and what you're going to continue in order to reach your goals. And then the Love Below is something that you love, but you didn't focus too much on, that you would like to incorporate as you continue to improve performance. And also just reporting back on how those reflections help the student reach the end of those rotations in order to be successful and to graduate, because they have to complete 4. I've also looked from the community aspect at street identified labor through, I would say, exploring Young Jeezy's Thug Motivation 101 album and how we relate to that album, but use aspects of what he's talking about in a different way. So if he's talking about, stacking dough, how do we do that? How do we use that as motivation? Even though we may not be participating in a street identified labor, how do we use his storytelling within our role of a worker in order to receive compensation? So that is operationalizing occupational status. How do I move from one occupational status, which could be, poverty or low socioeconomic, to higher middle class? So those are 3 ways that I operationalize the use of hip hop culture. And then lastly, I would state just exploring the benefits of using a hip hop case study for students to learn how to implement different intervention strategies. And so I've used Jay Dilla and, some of his diagnoses that he had to navigate before the end of his life. And the students actually had to fit him for a wheelchair so that he can complete his tour in Europe. And so asking the students how did that assist them in becoming confident and increasing their self-efficacy and fitting an individual for a wheelchair or prescribing an individual for a wheelchair. And I got a, unanimous response of it was 100% needed. It made me feel like I was incorporated into the class, into the syllabus, into this assignment. I felt seen, just different things like that. And so those are some ways that I've operationalized hip hop culture or aspects of hip hop within assignments, but also taking that data, using that as data in order to let the people know that the future of occupation is hip hop.
You're so brilliant. I just can't. You blow me away every time we talk. And when I first saw you present, and when you talked about like you just come with your natural self and just blowing people's minds with all you're talking. This is what I'm talking about. Your textbook example of why hip hop could save America. And I'm so glad we had this talk. It's long overdue. I really do thank you for your time. We'll finish up. I'll ask you the question that I ask most folks that come through the show. We've talked, so you already know my impetus for, naming this show, this lofty idea, as provocative as your statement is, that hip hop can save America. What comes to your mind when you hear that, when you've heard that, when you first came across that saying, that mantra, that, iconic logo that I designed myself? Thank you very much. What's your thought process when we say hip hop can save America?
Hip hop is saving America by keeping America alive. That's what's happening. And that's what I saw, or that's what I thought of when I first ran across your podcast, is keeping America alive. Black culture, people of color that have, I would say, inspired, was a part of the inception of hip hop is why this country is a reason why this country is, this is very provocative and a strong statement. And I don't have any evidence that I can actually cite right now, but I'm pretty sure I can find it. It's a reason why the industry in different industries are what they are. Hip hop is within the automobile industry. Hip hop is all up and through music. I mean, every new soundtrack to me has some aspect of hip hop or blues, which is a stem of hip hop. So when I saw Hip Hop Can Save America, I just immediately thought that hip hop is a huge reason why America is still here. From politics, people are conversing about hip hop, which is keeping those conversations alive, negative or positive. Beyonce just dropped an album, and there's a conversation about Jay-Z, and everyone is circulating around this one album. It's like the country and the globe stops. Right. So hip hop can save America because it already has, and it continues to, even though it doesn't get the credit.
Well. Preach. So, and I hope that you especially, me secondarily, continue to get the credit for the work you're doing in bridging these gaps in, these intersections that are quite clearly, just from your testimony tonight, helping people in a way that wouldn't have been possible were it not for you personally, and were it not for your combined cultures. Obviously, your Black identity, your Southern girl identity, and your hip hop identity. But the perfect storm, the best of all those worlds, is what I see in you, and the work that you do is testimony to that. And I hope that it continues, and I hope I can support it every which way possible from here until the end of time. So
I appreciate that, Manny, and I'm looking forward to us working together more.
Yeah. 100%. I'm right down the block. You know what it is.
You in Atlanta. I've Didn't necessarily promise you something, but in a way I did, and I'm still working on that. Step one is step one.
Okay.
After step one, which is a pilot that got some small funding, there's a larger one coming up that I'm applying for a grant and stuff. So I'm gonna keep true because it incorporates hip hop, and if it incorporates hip hop, I mean I need a DJ. So so anyway, I look forward to what we will do in the future. I really do.
I am, as in the words of the great Big Daddy Kane, I'm ready, willing, and able. RAW, ready, able, and willing. I don't know, whatever. RAW. I'm here. I'm here for you. So I appreciate your time. Anything coming up? Anything you want the people to know about? What do you got coming on? Anything you need the people to know? And I can reach you on the socials and all the end of the interview type stuff that we not gonna say.
Absolutely. So I could be reached, or you can check me out. JianJones.com. It's JIAN Jones.com.
I said you said your name like a Marvel superhero. You know that, right? Like, what do you mean? Like, it's always like Peter Parker or Jian Jones. Like, yeah.
Thank you for that. I needed that.
You my superhero. You my hip hop superhero.
But I mean, you're the one that's called Manny Faces. Isn't Manny Faces like a superhero?
Was a little. We're not going to talk about where it came from. I don't want no copyright. I don't want no IP infringement, trademark situations happening. But yeah.
But on Instagram, I am ITS Jian Jones. I'm also the hip hop OT. So that's the hip hop OT. And then, I mean, you could just reach out to me on there. Anything that's coming up. Well, it's Poetry Month, so I'm doing a bunch of poetry. Here.
Oh yeah, that's right. We didn't even get into that. You had a wonderful piece on your Instagram. Where's that piece that you had in parts? 3 parts. Where's that live? Because that was fantastic, but I needed to see it in its entirety. Where can we see this?
So it's on Instagram, but I am going to post the whole poem on YouTube as well as IG. But IG made me break it up, and so I got part 1 through part.
They won't let you be great. IG, they're not letting us be. I know. We good, but we can't be great.
I know they used to let you post like a 5-minute reel, but they don't anymore. So or at least I don't know how to do it. Anyway, right. Moving on. It will be on Instagram. But the name of that piece is Sojourn Her Truth. And that is the one manifesto that is the anchor to the text that I'm writing. It's an academic text. And it's titled Sojourn Her Truth, Occupational Injustices of the FemC and How She Rapped Back. So it's basically posing Sojourner Truth as the FemC archetype, and instead of stating or giving the speech "Ain't I a Woman," she's rapping "Ain't I a Woman," and her audience at the Women's Convention isn't a room of white women. It is a room of FemCs, all the FemCs and the one that took the charge very heavily, I heard you mention her earlier, was Rhapsody. When she was crying in this dream that I had. This was an actual dream that I had. And so I am writing that text on how the FemC has continued to advocate against occupational injustices of women in general, but how at the end, Rhapsody, being so moved, created her album Eve, her feminist hip hop album Eve. And so I go to juxtapose lines in Sojourner Truth's speech, "Ain't I a Woman," to lyrics on Rhapsody's album. So Sojourn Her Truth, Occupational Injustices of the FemC and How She Rapped Back will hopefully be available at the end of the year or the beginning of 25, because, you have to get a contract and all that good stuff.
Yeah.
So yeah, the piece, Sojourn Her Truth.
It's going to be a whole book. See, I'm trying to write a book, and I get jealous of people that write books, and then you tell me you writing this book. I'm like, well, then my book is stupid compared to it's not stupid. What an amazing concept. And I know. My book is fine, but we need that one too.
Because I thought that was stupid. I was like,
no, that's brilliant.
What I did was I turned it to a white paper. A white paper is a paper that isn't published. So I just put some thoughts down, and then I submitted that to a conference, African American History Conference, SALA, which is I think it's the Association on the Life and Study of African American History. And so they accepted it, and an editor from one of the academic press. Let me just say that.
Okay.
He approached me. He was like, "Hey, are you interested in turning this into a book?" And I was like, "I didn't think about doing it. This would be a really good book. So I think you should submit a proposal. Here's my card." And so
Right.
we've been talking back and forth. And so there's a movement, but I want to make sure that it gets out how I would like it to. And so
Understood. I know how that goes too. Yeah.
It was a small idea. So for your book, it's an idea, but that's what happens. Like,
let us all have books within the next, X amount of months. How about that? We can all eat in this game. And I love the piece. And I do encourage people, if it's still on your Instagram, to go check it out in parts. That's perfectly fine. You Netflixed it. It's all good. We can binge. I'll binge you. It's no problem at all. And please, and share with me so I can share with the folks anytime, anything you got going on. Happy to do that, whenever you're appearing or whenever you're publishing or putting something out. I appreciate you.
I appreciate you, Manny. Always.
All right, my friend. That's it. That's all we got.
Cool.
Go to bed. You got to teach tomorrow.
I do. It's kind of late, I fed my kids. But anyway, I'm about to eat something real quick and then I lie down. It's going to be nice and light though.
All right. I thank you so much. I'm so glad we got to catch up. Let's catch up again offline, ASAP. Anytime you're available, I'm around.
All right, we'll do. Peace.
All right.
Thank you.
Peace and love. Good to see you.
Good.
Dr. Jian Jones, the superhero of hip hop occupational therapy. I mean, come on. When I tell you the most brilliant, the most passionate, and the most innovative folk in hip hop can only be found here. I'm not lying. I'm just saying. I'm not down on anybody else. I'm just saying. Please do check out our good friend, Dr. Jian Jones. It's Jian Jones on Instagram. I'm Manny Faces. Your man, you mellow. This is Hip Hop Can Save America.
Manny Faces. You sick for this one. Sick for this one. Sick for